Hello everyone. Today I'm presenting my paper to you for the WorldCist conference. This work was carried out by myself and my supervisor, Mr. Ali Idri, and me, Izzat Mahmoud, and it is entitled Reviewing Data Analytics Techniques in Breast Cancer Treatment. During our presentation, we are going to follow the following plan, beginning by an introduction, where we are going to introduce the context of the paper and the goal of it. Then we move to the methodology followed through this paper. There we are going to show the outcome of the research. Then we are going to discuss the outcome and conclude the work and present future works. Well, as we know, data mining is the process of extracting new valuable information from large quantities of data. It is reshaping many industries including the medical one. And the breast cancer is the most common cancer and cause of death among women every year. It often causes confusion as to the adequate treatment to be adopted in different cases. The breast cancer treatment using data mining has an important progress, and researchers has become more interested about the topic since the medical decision makers require to be supported by data mining techniques. And the most type of treatments in breast cancer are surgery, radiotherapy, chemotherapy, hormone therapy, and biological therapy. So we collected 44 papers, we synthesized them and classified them according to year, channel of publication, research type, and data mining technique used. The goal of this SMS is to build a classification scheme to structure a field of interest. Well, as SMS involved a horizontal approach to the published studies. Systematic literature review discusses and analyzes the process and outcome of previous work vertically. So our paper process can be summed up in 5 steps: defining the research question, conducting a search, screening the papers, assigning keywords to each paper by using the abstract and data extracting, and of course mapping results. So to have our papers and to get the relevant papers, we did a research question. We put some research questions and search string, and the aim of the paper is to establish a broad idea of the published studies on the use of data mining techniques to deal with breast cancer treatment. For a broad perspective of the topic, we translated the global goal to 3 research questions. We are going to show them in the next slide. And the we targeted the candidate papers through looking forward 6 digital libraries. It was Explore, PubMed, Springer Lake, Science Direct, ECM, and Google Scholar. And we elaborated a search string to excel the operation of search. And this was done by gathering terms and synonyms figured out in the research question, and we associated all the alternatives and to link the most present terms. So we put for our selection process some inclusion and exclusion criteria. Hereafter, the inclusion criteria and exclusion criteria we used in this study are: for the inclusion criteria, papers should propose new or use existing machine learning techniques for breast cancer treatment. Papers should have an overview on the use of machine learning technique for breast cancer treatment, and papers should provide empirical or theoretical comparisons of machine learning techniques for breast cancer treatment. And papers published between 1991 and February 2019. And we exclude We excluded papers written in other language than English, papers dealing with other types of cancer than breast cancer, papers dealing with breast cancer diagnosis, screen, or prognosis. We got rid of duplicated papers, short papers with only 2 to 3 pages, and presentations or posters. So here are our research questions. What are the publication sources, and in which years were the selected studies related to data mining application for breast cancer treatment published? And the reason of this question is to indicate whether there are specific publication channels and when effort regarding this research area was made. The second question is how far data mining has contributed in making decisions on breast cancer treatment, and this to discover the type of contribution of data mining to the field of breast cancer treatment. The third question is what are the most common data mining techniques and methods to deal with breast cancer treatment, and this to identify the most common data mining techniques investigated in breast cancer treatment. So, to do so, a data extraction strategy was established by filling a form through which the most relevant information was selected to answer the research question. So the selected papers can be classified into the following types according to the topic they introduced. We have evaluation research, solution proposal, experience paper, and reviews. Well, this section of or this part of results where reports relatively the outcome of the research question. So to do so, we present first an overview of this selection process. So is here are the publication sources. So as we see, 44 selected papers were published in different channels, especially journals or conferences. 44.72% of studies were published in journals. 38.64% were found in conferences, while 28.36% had books or reports as a source. Here we see that researchers finally tend to focus on breast cancer treatment. This could explain the inefficient work regarding breast cancer treatment eventually in the past. However, the number of studies showed an increasing rate from the year 2016 to 2019, because we have 40% of studies done in 2016 were published in conferences. In 2017, 66.6% were published in a conference, and during 2019, 100% of studies were published in journals. Here, as we said, the selected papers could be divided into 4 research types: evaluation research, solution proposal, experience papers, or empirical evaluation and reviews. So the outcome is 46.51% of selected papers were solution proposal, proposing new data mining tools or techniques dealing with breast cancer treatment. 14% are evaluationary research, 16% were considered as review, and 23.26% of the papers were classified as experience. Note that the experience studies are in general difficult to carry out due to the difficulty of getting data of patients. Moreover, it needs a medical expertise to evaluate and validate the outcome, and the nature of the treatment task requires the experience, so we need solution proposal, experience papers which will be evaluated in papers, and we need studies that will gather all these in reviews. Here we see that the distribution of data mining techniques used according to each data mining objective. So, as we can see, the four objectives were investigated with association with 21.4%, classification 52.3%, clustering 9.5%, and prediction 16.6%. We observed that decision tree is the most used data mining technique for classification with a percentage of 50%, followed by fuzzy logic based model with 18%, then SVM with 18.1%, and association rules with 18.1%. After that, we found neural networks and GA and Bayesian networks with a percentage of 4.5% for each. For the clustering objective, Cummings is the most frequent, followed by association rules with a percentage of 75% and the second with 25%. As for prediction, neural network and decision trees are the most used with a percentage of 43% each, followed by association rules with 14.3%. And as we see, association rules are the most present when it comes to association with a percentage of 55.6%, then fuzzy logic based models and a priori with a percentage of 22.2% each. Now we move to the discussion to discuss the results of the systematic map of data analytics in breast cancer treatment to review the data mining techniques applied in this field. It also analyzes the result obtained for each research question. So the study with 44 relevant articles uh, dealing with data mining techniques for breast cancer treatment, and the variety of sources could be explained by a variety of data mining techniques and objectives that solve real-world problems. These sources have relationship with computer science data analytics applied to breast cancer treatment. Even though the number of studies breast cancer is still low, it has been increased in the last years. Therefore, we conclude that the coming years will come up with very interesting outcomes in treatment of breast cancer using data mining techniques based on the result of the previous uh, image where solution proposal is the highest type of studies. We for the how far data mining has contributed making decision on breast cancer treatment, we found that solution proposal is the highest, which can be explained by the fact that the data mining based solutions could bring an interesting push for breast cancer treatment studies. Solution proposal has reached its top in 2017, whereas experience papers start to show up remarkably in 2017. The evaluation researchers are not present due to the lack of empirical evaluation to assess the treatment task. This shows that the use of data mining techniques in breast cancer treatment is still not mature. Empirical empirical paper studies are present, and this is very important in the medical context because it gives more credibility to any study getting to the suitable treatment. And several data mining techniques were evaluated, and decision tree is the most frequent data mining technique used when it comes to the classification objective, which is the most recurrent task in breast cancer treatment. Moreover, the association rules are the best choice for researchers to deal with association task, and we could also note that the famous Cummings technique is still the most powerful technique for clustering issues, whereas the neural networks still very accurate for prediction problem. We could explain that by the fact that decision trees are faster and easier to use for classification. especially with the large choice of libraries offering the possibility to get advantage of this technique by reusing the functionalities with a large choice of languages. In addition, decision tree can be easily interpreted by the oncologist while taking decision without any background of data mining. As for association, the association rule is still the most preferred technique among researchers for the association task. Since there is no data mining technique that can outperform all the others in all the contexts, many selected studies combine more than two data mining techniques to deal with a specific data mining objective for breast cancer treatment. And also combining more than two techniques allows avoiding limitations and consolidating advantages of used techniques. So now we reach our conclusion. This work summarized and analyzed 44 selected papers published between 1991 and 2019 according to three research questions. So the finding by per question per research question are: the use of data mining among researchers has increased during the last years. As we said, the number of publications has remarkably increased since 2016, and most of the papers were published in journals and were found in conferences. And this SMS found out that the contribution of data mining breast cancer is very low, has increased recently, and therefore researchers should devote more effort to the treatment task, and most of the selected papers were captured as solution proposal and empirical papers. For the classification, it was captured as the most frequent objective in data mining because the problem is a classification one. And for classification, the decision tree gained more interest during the years followed by fuzzy methods and SVM. For the future work, we aim to get advantage of this SMS outcome to outperform a systematic literature review about the machine learning techniques investigated in breast cancer treatment and implement a solution of breast cancer treatment by evaluating the different machine learning techniques. Now we reach the end of our presentation. We hope it pleased you, and thank you so much for your attention.